Good morning. It's great to be here. I'm hoping that we will have some time for good discussion after this, so I might flip through some of these slides pretty quickly. They're all available on our website if you want to see them further. So why try to implement the SPM in the ACS? I think I'm preaching to the choir here. We know that the ASEC sample is not large enough for single-year state-level poverty estimates, and certainly not large enough for sub-state poverty estimates. The other reason to implement the SPM in the ACS is because everybody's doing it. And we've heard this morning about New York City, Wisconsin. We'll hear about the Urban Institute. There have been attempts in Philadelphia, San Francisco. Haven't heard about those lately. California, Virginia, now Oregon. And there's an interest in, are these estimates that different states are producing, are they comparable to each other? And what about all the jurisdictions that do not have the funding or the resources to put together their own measure? So what my goal has been in this work at the Census Bureau, our goal at the Census Bureau has been to put together an ACS public use file that would have all the SPM variables you would need to do an SPM estimate for your state, for your PUMA. The smallest geography on that file would be a PUMA. And we've been doing it all using the public use file, not the internal file, so that we would be able to share it with people and other people would be able to use it. We didn't want to go through all the work of doing it on the internal file and then have to go through the process of making that into a public use product. So we're just starting it off as a public use product. So this is what has to be done, and this is what Oregon's got to do, is what any state has to do. This is what, the process we've gone through to produce this file. So first of all, to harmonize all the variables between the American Community Survey and the current population survey. They, are coded differently. They have different race codes, different income codes. Try to get those as harmonized as possible. Put together a unit of analysis. There's a problem in the ACS that we only have relationships to the head of the household, so we don't have unrelated subfamilies in the ACS. We can put together cohabiting partners. There's a response if you are a cohabiting partner of the reference person of the household, but other cohabiting partners we cannot put together. We have to put together the resource measure. We have to impute a number of things that are not on the ACS file, put it through a tax model so we can get taxes and do the geographic adjustments. The challenges, as I mentioned before, was the unit of analysis, that we don't have those rich relationship codes on the ACS that we have on the CPS, so we cannot replicate the SPM units. Thresholds, we have to worry about the inflation adjustment. People in the ACS, it's a rolling sample. And also how are we going to do the geographic adjustments when the only thing we can reveal on that public use file is the PUMA. Resources, how do we do non-cash benefits, and how do we do the necessary expenditures? What we've been doing for the unit of analysis is using the rules that IPUMs puts out. Many of you probably use the IPUMs public use file, so you already have those parent pointers on there. We don't have those on our Census Bureau products. We have tried to replicate the rules as closely as we could to the IPUMs relationship rules so that we could put together those pointers. And those pointers are needed not just to put together the SPM unit, but to put together tax units, to put together food stamp units, put together health insurance units. So we've been doing that. Using those, we are able to identify or impute that there are about 375,000 unrelated subfamilies, and we reduce the number of unrelated individuals by about 4 million when we put these pointers on. For the thresholds, we are translating the MSAs to the PUMA level to adjust for geographic differences, and we use the average calendar year to take care of the inflation problem. That's probably the smallest problem. Biggest problem, or one big problem, is the non-cash benefits. The only thing we know on the ACS is SNAP benefits. We have to impute all these other benefits if we're going to consider them. In the CPS, we have at least yes, no, whether you participate or not for each benefit in the survey. We have amounts on the CPS for SNAP and for low-income home energy assistance program. We have no amounts on the ACS at all. The imputation strategy that we use is trying to keep it as simple as possible. So what we have done is do using the CPS ASEC to model both program participation for everything but SNAP, using a logistic regression model to try to impute whether or not you get WIC, whether or not you participate in school lunch, whether or not you have housing assistance, or whether or not you get LIHEAP, and then model the benefit amounts for SNAP and LIHEAP, again, using that CPS ASEC. And we've been using the PROC-MI and SAS so that it's essentially a predicted means match to find a household that's similar in the CPS ASEC data to the household in the ASEC data, or the SPM unit in the ASEC and the ACS data, and then bring that amount over to that record. We used, as we do for the CPS, we use administrative data to assign the values for WIC, school lunch, and housing assistance. So we're using very much the same method that we use with the CPS ASEC. Here's a little bit of our results. You can see they're not, you can see all those asterisks that we do get statistically different aggregates for SNAP, school lunch, HEAP, and WIC when we do this. But in the aggregate, the imputations look okay. What we were all really most interested in the marginal impacts of each of these programs, and so this chart compares the marginal impacts from the using the ACS to the CPS, and you can see they differ for SNAP, but for the other programs, the differences in the impacts were not statistically significant. So I think that's fairly comforting, as this may be a way that we can go forward. Same issues are with necessary expenditures. In this case, we have nothing on the ACS, and so we have to impute it all. Taxes, we use, I don't know, this says ACS. We're using the CPS tax calculator. We have to adjust a few things because we have limited relationship data to make those tax units. We have less specific data on the income sources. In the CPS, all those specific questions on income allow us to parse income into taxable and non-taxable. We have this big chunk of other income on the ACS that has to be divvied up into taxable and not taxable. We use, as we do for the CPS, a match with IRS data to get itemized deductions. So we don't have to assume that everybody uses a standard deduction. For childcare and MOOP, do something very similar to what we did for non-cash benefits, using a logistic regression to first decide whether or not you have childcare expenses, and then if you do have childcare expenses, using that predicted means match to get a weekly amount from the CPS ASEC. Using the report of the weeks worked, which is unfortunately categorical on the public use ACS file, but using those reports to get your child care. For MOOP, divided the ACS into 3 groups: families, elderly, and unrelated individuals, and did predicted means match to model premium amounts for those who report that they have private insurance, and use a similar model to get other medical expenses. So we did separate, like New York City has started to do, we separated premiums from other medical expenses. And here's the results we got for the aggregates. Again, statistically different between the 2 surveys, but in the ballpark. And the impacts. We had a little higher impact for MOOP and work expenses, but a little less for federal taxes. But of course, what we really care about are the eventual poverty rates. And so one thing to keep in mind is even with the official poverty rate, ACS and CPS poverty rates are not the same in a given year. They have different reference periods, and of course ACS has much less detailed income reporting. SPM, we have the added complications of lacking the relationship pointers and using so many imputations. So looking at this chart, you can see the striped numbers are the official, where you see the ACS and the CPS are different, and the solid colors are the SPM, where again we see the ACS poverty rates coming out a little bit higher than the CPS poverty rates for total and for each of the age categories. What we really kind of care about are the differences, right? The difference between the SPM and the official and the CPS and the ACS. This is probably the only group where I can show this slide and not have to talk a lot, but we can see that they come pretty close, okay? both the ACS and CPS, we have the big increase in poverty for people over 65, decrease in poverty for children, smaller increase in poverty for non-elderly adults. We get a little bit more, bigger difference overall for the ACS compared to the CPS. Looking at the state level, these maps you can just, I know you can't, they're too small to read all the numbers on there, but you can kind of look at the colors and see that basically the state rates are coming out in the same ballpark. The dark colors are in the same places in the country with lots of individual differences. I think I have it on that last slide. I think it's about half of the states where the differences between the CPS and ACS are statistically significant with these two methods. This picture shows you the impact of non-cash benefits. You see they don't range, there's not a big range across the country, but we do see the dark blue in the same place there, a little bit different for New York State between the two. And the impact of necessary expenses, here the maps don't look, I don't think the colors match quite as nicely. So we haven't done as good a job of distributing those across the states. These estimates were for 2011, so I was able to get the poverty rates for California, Virginia, Wisconsin, and New York City. And so this chart looks at the state-specific poverty rates when the states are doing things their own way, the CPS ASEC rate, and then the rate from this project that we've done at Census. So you can see how those track. That we do have much higher rates for New York City, but that's probably a function of the way that New York City treats housing, that we are not able to, we don't do in our data. New York City does a big adjustment for people in rent control that we don't have reflected in our method. And that's a good, and that's a good example of, in California, the adjustment for some of the geographic specific adjustments they've done in California. We get a bit higher poverty rates than California. I think that when we look at these comparisons, the goal is not for them to all come out the same. I think that we recognize that specific states have been able to model specific policies and programs that they need to look at and situations in their state that they can look at, and they have access to administrative data. What we're trying to do is kind of the plain vanilla generic version that any state could pick up, and then add on to that what administrative data they have and what special situations they have that they want to cover in their state. I won't go through these things. I do want to say that since I did this paper, this was I think for PAA last spring, we did have we were able to spend a little bit of money with a contract with the Urban Institute, which I think Health and Human Services actually maybe paid for, but it was a joint agreement there where they looked at the imputations that we did and provided us with some feedback. Generally, they found that the imputations do a pretty good job of capturing the CPS information on the program benefits and the expense amounts, and they gave us some specific hints at places that we might want to look at improving our models, and we're in the process now of redoing this and trying to put it in a more production mode so that it's not just a research project anymore. It's something that we'll actually be able to put out to the public and to take advantage of what they were able to look at to be able to improve some of our models. As everybody else, our next steps are trying to improve this to see if we can incorporate some of the suggestions from the Urban Institute, still open to evaluating alternative strategies. Like anybody else working at the state level, MOOP in the thresholds is very appealing because it's very hard to model that MOOP to subtract from resources. We've got some work going on looking at our own tax calculator, and we have been able to get TaxSim installed at the Census Bureau, so we are considering using TaxSim to actually do the taxes for the ACS. And always working on improving those relationship pointers. Those turn out to be very important for health insurance units. So we're lucky that the health insurance people are very interested in getting those pointers right because they're looking at how to edit non-response to health insurance questions. And we're going to piggyback on the research that they're doing to try to improve those pointers and see if we can make, get those SPM units together. So, all right. Thank you.